Hello, Colin Hung for Healthcare IT Today, and I'm here at HIMSS 25 in Las Vegas, Nevada. I'm excited to sit down with my next guest to talk about, guess what? AI. But we're going to cover it in a slightly different twist. I'm looking forward to having a conversation with Ben Scharfe from Altera Digital Health. Ben, welcome to the program.
Thank you so much, Colin. As I said, I'm super excited to be here. I've been really looking forward to this conversation.
Well, I hope I live up to the hype. But I'm excited because, listen, AI has come very far, very fast in the last few years. It wasn't that long ago where it's like, oh, this is a nice novelty. Last year it was sprinkled on everything, outrageous claims that it was going to improve healthcare by these phenomenal moves. But now I think we're in the realistic phase of AI in healthcare. You know, in your opinion, Ben, have we moved too far too fast with AI? Are we in the right spot with AI right now in healthcare?
I don't think that we've moved too far too fast. I don't think that we're, really getting into the deep end of risk and starting to, use it. There's a lot of caution. There's a lot of trepidation. Generally, organizations that I work with are piloting. It's very small scope, and that's the right way to approach it. And I would say that people are, really experimenting with things that are lower risk and kind of starting out that way. I would say that also generally from a regulation standpoint, we've done a good job of making sure that no one can go totally wild, especially from a certified health IT standpoint. There's definitely some good guardrails there to make sure that no vendor is pushing things too far too fast. From the foundational model vendor perspective, I'd say that there's a pretty good variety there, where OpenAI, for example, is pretty aggressive, whereas some of the other vendors are a little more conservative and taking a little bit of a slower approach.
Yeah, and I find that AI in the clinical side, definitely we are taking, I'll call it a traditional healthcare approach. Very cautious, experimenting, making sure, lots of regulations on what that is. But on the administrative side, I think, I won't say too far too fast, but we've certainly hit the accelerator there, where we are using, I hear a lot of people using Gen AI for personalizing communications with patients, generating content, generating patient education materials. It just seems we're moving very, very fast with AI on that front.
Yeah, and I mean, generally when you're generating content, right, or like engaging with a patient, as long as there's not really a material risk of harm, and you've got some of the foundational controls like having human in the loop, right, having people that can review and double check, hey, what did this autonomous agent say to someone? You can kind of cultivate that trust over time. And generally, there's domains where it's sort of like, well, what could really go wrong? If I create a document that is for internal use, and then you do enough of those that you're confident that this thing's producing good quality outputs,
right,
then you can have that comfort to go ahead and do that. But it's really as you get into like decision making and deciding how to take care of someone that that's where we need to be really cautious and take our time and make sure that, because hallucination can be really damaging.
Now, in doing the prep for this interview, I was really fascinated by this one thing that you have that you're championing over at Altera, which is this idea of stratifying risk levels of AI. You have something you call low risk applications of AI and high risk applications of AI. Can you explain what that is?
Absolutely. And I think, when the way I look at it is the farther you are away from a potential negative outcome, the lower risk, right? So the farther you are from a clinical decision, the more you're closer to the low end of the risk spectrum. And then also the more sensitive the data that you're processing, the higher you are in the risk spectrum. So for example, there are ways that we can help a patient have a better experience going to a hospital, just deflecting some of the questions they may have that, it can be stressful to go to the hospital. You've got questions about, where do I park, right? When I get to the building, what's it going to look like? Do I go left? Do I go right? And just like some of these silly things that are really, there's almost no risk to helping someone get a faster response to that. And then again, if you've got a human in the loop behind that, they can sort of triage and just carefully observe, make sure that the agent, that you can put parameters around what someone can ask, what the agent will respond to. And so I think there's a lot of opportunity in the low risk end of the spectrum. But the interesting thing is that from a regulation standpoint, the ONC hasn't, for certified health IT, has not made that distinction. So the approach has been very guarded and just blanket approach. Exactly. Yeah. So just this is what, is predictive decision support intervention, and it's a very, very broad definition. And then if you're a certified health IT vendor and what they refer to as the configuration nexus, if you expose anything that's a PDSI, you're kind of subject to the full set of regulations.
I like how you have that sort of dual vector there of the sensitivity of the data that you're basing the AI upon, as well as the actual application of that AI. Because I think you agreed. I mean, having an AI agent maybe answer some questions on what the hours of operation are, the directions of how to get somewhere, pretty low risk, right?
Yeah, exactly.
But very, very helpful. But on the other hand, if you're using AI maybe to generate some content that's based on the patient's condition, it's probably okay, like in terms of the actual generated content, but I like the fact that you're pointing out that that's based on some sensitive data. So you might want to take a little bit more of a cautious approach there.
Yeah. Yeah. And so in that regard, I think that there's a lot of opportunity for generating content, but then treating that content as like an artifact. So for example, right, you can create content, generate, and that's actually, I'd say ambient listening, essentially you create an artifact, right? You create a record, but then someone reviews it, but that's a kind of a single instance. But if you think about like creating patient education, right, we're always needing to do more of that. You can use AI to streamline the creation of it, engaging a conversation and a clinical expert, taking the transcript from that and then outputting a document that someone can review and say, yep, this is good, we can publish this. But when you get into something that's very personalized to a patient, that's where you need to be truly and entirely generative. And that's where, there's a lot more risk, because if you're not able to really observe and carefully scrutinize the output, then, you've got to have trust in the system.
So Ben, are there any other examples of low risk applications that, you're excited about?
Yeah, I mean, definitely in rev cycle, there's a lot of opportunity. For example, just yesterday I was talking to an organization called Outbound AI, and they do, essentially autonomous telephony to the payers. So allowing the health system to sort of reduce the administrative effort around claim status follow-up, appeals, et cetera. And so I think there's lots of different opportunities in rev cycle, as well as in patient engagement, where again, you're, taking on deflecting some of the low risk cases, some of the frequently asked questions, something where you can use like retrieval augmented generation to back the AI against something that really grounds it. Here's the answers you can give. As soon as they ask these questions, maybe you alert someone. And there's interesting technology platforms where essentially you can have a human hijack a conversation, right? So you've got the administrative team who would otherwise be fielding the patient outreach is sort of keeping an eye on, what the agents are saying, and then it's like, oh, hey, let me jump in here.
Now, Ben, I was remiss. I jumped right into the topic because it was so juicy to me to talk about AI. I forgot to ask you a little bit about Altera Digital Health, so you can tell our audience a little bit about the company.
Oh, absolutely. So Altera Digital Health, the background is it came about 3 years ago when Harris acquired the hospital and large physician practice business of Allscripts. And so we've got a number of different EHR and rev cycle systems. We generally serve medium, the mid-market, right? So Sunrise is one of our products, as well as Paragon, which serves more rural health, and then TouchWorks is our outpatient ambulatory product. And really at TouchWorks, the focus of our business is really being very client-centric. And I'd say that was something that was a bit of a transformation when we acquired the company. We really, the first thing that we did was we spent time meeting with clinicians and leaders from our clients, getting an understanding from the front lines. And to give a bit of a longer answer, what we were met with was a bit of a sense of like cynicism around the industry, right? You hear from clinicians, there's all this cool tech, and you go to HIMSS and you see all this like really exciting stuff, but then how come it never makes it into my hands? So we recognize that disconnect, and what we kind of redefined internally was this need to really, rather than when we go to meet clients, rather than focusing on showing them inspiring, innovative, technology, just focusing on listening and just sort of sitting with them and understanding what outcomes do you really care about, what matters most. And so now we've redefined how we measure ourselves, and we now measure our own success by the outcomes of our clients. I know the outcomes is something that you're really interested in.
Yeah, well. I was actually going to ask you that. So in your opinion, Ben, are we at a point where we're seeing good outcomes from the deployment of AI in healthcare?
Yeah, we definitely are. But the interesting thing, I was just talking to a number of CIOs. We had a great focus group, and I felt a little bit vulnerable myself in, feeling that, well, some of the outcomes feel kind of squishy, kind of soft. It's not like we're seeing these hard, what I would say are lagging indicators of like patient health outcomes or, financial outcomes that are really material. We're seeing a lot of provider satisfaction, patient satisfaction, some of these things that I'd say directionally indicate we're getting good, good improvements, and lots of, anecdotal, hey, wow, I'm so much more fast, it's so much more efficient, I'm saving time, but there hasn't been a level of maturity and controls in place to really measure all those things directly. So I was happy to, not happy, but I was from the CIOs I was talking to, it was sort of this common challenge. Everyone was saying, yeah, we're doing this, we're doing that, but the outcome measurement is still a little bit squishy.
Well, and we were talking before we got on camera about the fact that a lot of the outcomes are workflow-based, process-based, administrative-based. And I think that's pretty good. At least we're getting some ROI.
Yeah.
I'm hoping that we get quickly to real patient outcomes, improving healthier patients. Do you think we're heading that direction? We're going to get there?
I think so. Because when I think about, ambient listening is sort of the thing that everyone is really, there's tons of startups doing it, right? There's a lot of excitement around it, and it's for good cause. And I think it's sort of one of those things that you can feel it's in the right direction, because just when you have an encounter with a provider and they're using ambient listening, they're not looking at the screen. You're kind of got that, that human connection.
Right.
And I think that really drives, that connection is what drives influence, right? So it allows a provider to have a greater level of influence on a patient, allows a patient to internalize their instructions a little better, get a little more clarity around maybe why it's important that they adhere to the care plan, what it's going to mean, and they maybe have a little bit more time for interaction and question and answer. And so I think that those things will organically, result in improved health and patient outcomes. And I also think on the other side, when we think about some of these gains in terms of efficiency, those things will slowly drive the cost of healthcare down and make care more accessible to more people. So I really do think that there's this amazing opportunity now for more people to get access to care, because it'll become more affordable and efficient, and more people will get better outcomes because, we're now allowing providers to become, healers of people again, rather than administrators of care.
Right. No more having to learn codes or anything like that, right? For a clinician.
Exactly.
Well, I like that you're an optimist, Ben. I like that you're an optimist. So, Ben, if you were to sort of take our conversation today and say, what's the one key message that you would like the audience to take away from this conversation?
So it's probably not something that we've talked about much yet, but actually the thing that I really feel very passionately and strongly about is I hear a lot of individuals, teams, and organizations who are taking a bit of a wait and see approach. They're thinking, well, I'll wait for my EHR vendor, or I'll wait for someone to really hand me a nicely packaged, product. And that's why you have a lot of startups who are, but the reality is health systems can't afford to buy, 40 different point solutions for AI. And so I actually really think that individuals and health systems should be engaging with the foundational technology, and just going right to the models, right to the model vendors, and starting to do a bit of their own experimentation, and just sort of, again, in a very low risk end of the spectrum, just experiment with it for creating internal documentation, servicing internal staff around things like HR and benefits, because a lot of the internal controls are going to be the same, human in the loop, transparency in the model outputs, leveraging citations, bias mitigation, and expert validation. No matter where you are in your AI journey, those things are going to be relevant. So organizations should start to build that muscle without simply waiting for someone else to serve it up. Because this is really, I don't see, AI is not a product. It's a foundational technology that will result in a multitude of products. And so I encourage clinicians and individuals to play with it in your most low risk setting. Ask it how to take a picture of what's in your pantry and ask it what you can cook, and just get comfortable with the tech. And then over time with that, it'll allow people to get more comfort into how to use it more and more creatively.
So what I'm hearing is, don't wait, go experiment with some low risk stuff. Get familiar with it.
Exactly. Start at the absolute bottom of risk, and where really nothing can go wrong, and where you're able to put eyes on the output and really, be confident in what you're generating. And then slowly from there, you'll build the confidence to go farther. And I think what's really important is integration's always a challenge. So health systems should have their EHR vendor at the table, engage in dialogue, so that you're sort of paving the way to allow for those more, deeper risk use cases where you're really leveraging that sensitive data from your vendors. But I really encourage health systems and individuals, don't wait. Start to dip your toes in the water, but start at the really shallow end of the pool.
I love it. Ben, final question for you. Where can people go to learn more about Altera Digital Health?
At our website, just search Altera. And on LinkedIn, we've got lots of great articles, lots of great content, lots of good thought leadership, and certainly I've been posting a lot on LinkedIn. We've been putting out blogs, and we're just really, more than anything, we're looking for health systems and clinicians that want to experiment and want to engage with us and engage in the dialogue.
Definitely would encourage you to check out Ben's stuff. He posts a lot of really great things on LinkedIn. Ben, thank you for being on the program. Thanks for sharing all this great information.
Thanks so much, Colin. This was an absolute pleasure.
This is Colin Hung with Healthcare IT Today. If you liked this interview, please mash that like button. Also click subscribe. Head over to healthcareittoday.com for more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.